Why is metabolic dysfunction key in cancer cachexia? Imagine a body fighting a battle on multiple fronts. Cancer cachexia is a complex condition where the body's metabolism goes into overdrive, causing severe weight loss and muscle wasting, even when someone is eating enough. This isn't just about not eating enough. It's about how the body's energy systems are fundamentally disrupted. In lung cancer and other cancers, this disruption is driven by widespread changes in how the body processes nutrients and energy. Cancer cells are voracious consumers of nutrients like amino acids and fats, which they need to grow and multiply. They send signals to the rest of the body to break down muscle and fat tissue, releasing these nutrients into the bloodstream. This process is called tissue breakdown, and it fuels the tumor's growth while leaving the patient weaker and thinner. One key factor is increased energy expenditure. Normally, our bodies produce heat and burn calories at a steady rate, but in cachexia, the body's mitochondria, tiny power plants in our cells, become less efficient. They start to produce heat instead of energy, leading to more calories burned even at rest. This process, called mitochondrial uncoupling, makes it harder for patients to maintain their weight. Another important aspect is how the body handles glucose, the main fuel for our cells. In cachexia, the body develops resistance to insulin, the hormone that helps cells absorb sugar from the blood. Instead of using glucose normally, the liver ramps up glucose production through a process called gluconeogenesis. It uses amino acids from muscle tissue to make this sugar, which means muscles are broken down even more. This creates a vicious cycle of muscle loss and energy imbalance. Systemic inflammation is also a major player. When the immune system releases cytokines like tumor necrosis factor alpha and interleukin-6, they interfere with normal metabolism. These molecules promote muscle proteolysis, or muscle breakdown, and fat loss. They also make the body less responsive to insulin, worsening the energy crisis. Tumors themselves secrete factors that directly cause tissue breakdown. Molecules like parathyroid hormone-related protein and certain microRNAs signal the body to release nutrients from muscles and fat stores. This process helps the tumor get the resources it needs but leaves the patient increasingly weak. The impact of cachexia isn't limited to muscles and fat. It affects multiple organs including the liver, brain, immune system, and heart. This systemic effect reduces quality of life and makes treatment more difficult. In lung cancer, cachexia is especially common and can worsen prognosis and how well treatments work. Because the root of cachexia lies in these metabolic and inflammatory changes, simply increasing food intake isn't enough. Addressing these underlying processes is essential. Researchers are exploring ways to target inflammation, metabolic pathways, and tumor-host interactions to slow or reverse tissue wasting. Understanding these metabolic changes helps us see why cachexia is so challenging to treat. It's not just about nutrition. It's about restoring balance to the body's energy systems. For lung cancer patients experiencing cachexia, managing these metabolic dysfunctions can improve comfort, strength, and overall quality of life. Always remember, each person's experience is unique, so personalized medical care is key. If you or a loved one are dealing with cachexia, consult your healthcare team for tailored strategies to support your health.